Hi everyone, welcome and thank you for joining today's webinar on SARS-CoV-2 and wastewater monitoring, linking research and application to meet immediate needs. This webinar is part of EPA's Office of Research and Development's Water Research webinar series that typically has webinars every other month. We have a great presentation today. Before we get started, I'd like to just go over a few quick items. First is that you all have a PDF copy of the webinar slides located in the handout in the right-hand navigation bar of your GoToWebinar panel. We would love to hear questions from you, so you can type questions at any time in the question box located in that same navigation panel on your screen. We are going to save 30 minutes for a Q&A panel after all of the presentations, so we are going to hold all questions until then, and then ask all of the presenters the questions that you all submit. So we encourage you to submit questions throughout the presentation so we can have a robust Q&A session. If you have any technological issues during the webinar, you're welcome to chat at us in that same questions box, or you can email that webcast info email address that's on your slide on the screen. This webinar will be recorded and it'll be posted on the Water Research Webinar Series webpage within around 2 weeks after the webinar. And finally, if we can go to the next slide, we will provide certificates for this webinar. A few requirements for those: so you must be registered or be in the room with someone who's registered for the webinar. You must attend the live webinar for 60 minutes. And if you are in the room with someone else who registered, please give us those names in the chat box or go ahead and email webcast info email address on the screen. Next slide, please. So finally, before we get started, I just wanted to share a couple upcoming webinars that might be of interest. First is the Tools and Resources webinar on Lead Action Plan Research Update on October 21st and on October 28th, health effects associated with harmful algal blooms and algal toxins, from this same Water Research webinar series. So with that, I will pass the microphone over to Greg Sales, who's the Director of EPA's Center for Environmental Solutions and Emergency Response, and he's going to go ahead and introduce today's presenters.
Fantastic. Hannah, can you hear me? Can you hear me? Oh, great. Thank you.
Yep.
Well, greetings. Okay, good. Greetings, everybody. So glad you joined us today. Back in April, when we were all immersed in our first month of COVID-2 and many of us working at home, EPA very quickly started up a research program in SARS-CoV-2 work with the idea that we would work on some very applied, actionable research that would be useful to the nation, during this pandemic. We started up work in cleaning and disinfection research. We worked on analytical and exposure methods. We're working on aerosol transport modeling, and then in line with today's webinar, we also started up some wastewater related research, including the stuff we're going to hear today about relating signals in wastewater back to community infection. So of course, in order for this work to be as really quickly usable, the laboratory work that we were doing really had to be linked to the folks applying the work. And so what you're going to see today really is a great collection of partners all working towards the same goal. So we have EPA researchers, we have the Cincinnati Metropolitan Sewer District, and we also have the Ohio Department of Health represented today. So let me go into introductions. So these are our speakers for today. We're going to open with Dr. Jay Garland, who's a senior scientist at EPA Center for Environmental Solutions and Emergency Response. Jay has 30 years of federal service. He's worked on many things, including a range of topics, mostly around microbial processes and pathogens. Jay has a PhD in environmental sciences from the University of Virginia. Second speaker will be Bruce Smith, who is Assistant Superintendent of the Regulatory and Compliance and Safety Division. At the Cincinnati Metropolitan Sewer District, Bruce has a professional engineering license, bachelor's degree in chemical engineering with some additional graduate work in environmental engineering at the University of Cincinnati. Third speaker is Dr. Nicole Brinkman, who's a microbiologist at EPA Center for Environmental Solutions and Emergency Response. Nicole conducts research focusing mostly on waterborne pathogens and antimicrobial determinants in the environment. Nicole has a PhD in biological sciences from the University of Cincinnati. Our next speaker is Dr. Scott Keeley. He's an interdisciplinary scientist with EPA Center for Environmental Measurement and Modeling. His research focuses on bioinformatic analysis of next generation nucleic acid sequence data from various microbiomes. Scott has a PhD in molecular genetics, biochemistry, and microbiology from the University of Cincinnati School of Medicine. And our final speaker today will be Rebecca Fugit, who is Assistant Chief in the Bureau of Environmental Health and Radiation Protection at Ohio's Department of Health, where she's been working for 19 years. She oversees programs related to water and sewage, harmful algal blooms, fish consumption advisories, Legionella, and much more. Rebecca has a BS and MS in geological sciences from Ohio University and is a registered sanitarian. It's my pleasure then to pass the torch now to Dr. Jay Garland, and let's begin the seminar.
All right, thank you, Greg. I assume everyone can hear me and see me.
I can hear you, Jay, and see you.
All right, so as Greg emphasized, and as the title reflects, the work we're going to talk about today is really a fusion or linkage of method development and its application, given the need to move quickly to respond to the pandemic. It's also, I want to note, this work is highly collaborative. Greg mentioned that, noting the speakers. I've listed here the different entities that are involved. You're going to hear from some of them, but not all of them. I'd also like to point out that the Ohio Water Resources Center, Rebecca's going to talk a little bit about that with you at the end. I really want to call out Susanna Bolarova, who's leading the effort for the Ohio Water Resources Center interfacing with the state. Her work has been really invaluable on this. But I want to emphasize it's not only collaborative, but it's ongoing, right? So you're getting a peer into what we're doing right now, and this is still in the middle of the work, especially as it interfaces with Ohio and the efforts they have to use this information to respond to public health. So thanks for kind of peering into the system as we are working on it. Just as a reminder, I think everyone's probably aware of this, but that, you know, here we're talking about wastewater, not as a source of contaminants and risk, right? I mean, that is an issue. There's some questions about infectivity of the SARS-CoV-2 in wastewater, and that work is going on. But right now, what we're talking about is using the sewer as a mirror back to society, as quoted here from Jirtan Medema, who did some early work and continues to work in this area of wastewater-based epi, where you're looking at the wastewater as a mirror back to public health. And using that graphic, right, that we want to use the wastewater as a sewer, I think the sewer as a mirror. What I want to emphasize today in this talk is that what we're doing is trying to look at some of the reasons that might distort that view, right? So in this next graphic, you can see there's several knobs on the right-hand side, and we're going to talk about some of those knobs, some of the levels that might be creating uncertainty in the clarity of that reflection. And I think our work as scientists at this point, as well as utilities and public health officials, is really to work collaboratively and simultaneously on these knobs. We're really trying to dial in the signal in the sewer back to public health. And that's a challenge, even under long-term plans, but even more so because we tend to be working on these knobs simultaneously. But that is the nature of the situation and why we brought in multiple players to work on this collaboratively. So the outline of the presentation reflects that collaboration and really talks about both these levels of uncertainty. Bruce is going to talk first about really trying to talk about sampling and characterizing the sewer district so you understand what might be affecting the signal. Nicole's going to talk about the analytical development, uncertainty related to the method itself. Then Scott's going to talk about trying to relate the analytical determinant in the sewer back to what are other imperfect measures of community case rates. right? So you can think of those first three as really those three knobs, the three layers of uncertainty here that we're trying to work on. And then the final fourth point is really then trying to translate this information, because no matter how much you reduce the uncertainty and how confident we are in the signal, in the end, the true value of this is going to be measured by how useful it is for the public health decision makers. And that's what Rebecca's going to talk about in terms of the Ohio effort that we're collaborating on. So with that, I'm going to turn off my webcam and turn it over to Bruce to start off.
Thank you, Jay. Can you hear me?
Yes, I can.
Great, great. And then, as Jay said, I just want to give you a perspective on Cincinnati MSD's sewer system, some of the characteristics that we've looked at and continue to look at in partnership with the team. So on we go, Jay. Just to give you a picture of that, our district. We serve about 800,000 customers throughout Hamilton County, Ohio, which is located in the very southwest corner of the state of Ohio. We operate 7 major wastewater plants represented here by the red dots, along with their respective sewer shed borders. 7, maybe somewhat unusual for a sewer district to have that many. We're driven significantly by topography, where we site those. As another data point, we have over 90 pump stations throughout our system. Also, the city of Cincinnati itself occupies parts of the Muddy, Mill Creek, and Little Miami basins. And the curved line at the bottom of this map represents the Ohio River that we border and where our wastewater is discharged. Next slide. So we recognized that if we were to be providing 24-hour composite samples from our respective treatment plants, that there would likely be some distortion factors, as Jay mentioned, and we would want to account for some of those. So this table represents a couple of those distortion factors that we thought would be important and gain some perspective. The average daily flow of these facilities is there in the parentheses to give you an idea of their size, a fair range. And then as you can note, the industrial component, the industrial wastewater discharge to our system in that table. The Mill Creek treatment plant serves really the center part of our county, and really the Industrial Valley is very much a part of that Mill Creek. The Little Miami has a fair component, and then to a large degree, the industrial components drop off for the rest of the treatment plants. They're primarily commercial and residential. Also related is we have combined sewers, and combined sewers somewhat relate to the age of our sewer system too. You see the blue arrow on the left, my left anyway, of the screen, denoting really kind of the average age of our sewer systems. And combined sewers play a role, particularly in the dilution factor. We've got some sewers that date back to the 1800s in some of these older systems, and they're pretty leaky. So the column on dilution is really, again, to give some perspective. This is really a ratio of the average strength of our sewage compared to typical. And you can see the top 4 are diluted approximately in half of compared to what we would expect typically. The combined sewers, maybe not unexpected. You might notice the treatment facility Sycamore Creek is particularly leaky for ostensibly what is just a sanitary only system. Next slide. Another potential distorting factor is how long does the sewage reside in our collection system. We've got a fairly well-developed model of our collection system, and we proceeded to model the average time in each of these. We put a pulse in and then took a centroid and did that throughout the day, so we get an idea of where the timing might impact when we had samples, and overall, when we had composite samples, how long they had been in the sewer. So you can see a range, approximately 2 to 6 hours. Our Mill Creek facility being with the largest collection system, not surprisingly, has the longest residence time as an average. Next slide. So we also wanted to evaluate establishing some sentinel sites or sentry points in the system rather than just look at our treatment plant composite samples. So what you see here, the blue outlines are the sewer sheds, and the magenta outlines are our sub-sewer sheds. So we took a look at a number of these, and as alluded already, we jumped into this while the pandemic was already started. So we had some case data already. We focused on one particular sewer shed in the lower part of the Mill Creek Valley, our Lick Run sewer shed. Jay's outlining there. This particular sub-sewer shed had some demographic features that we thought were important. They had a significant portion of frontline workers that were in order to work, couldn't stay home. It's also a densely populated area. It also has little to no industrial component. So if you'll bring up a little zoom in on this this particular sewer shed, what you can see here, you see the Lick Run, the waterway that for the most part was sewered over years ago, but we're reestablishing through the center of that, and it's very hilly. You can see not development in some of the portions of this, but what you can also note is where there is development and housing, it's very dense. You can also note this particular sewer shed in the lower right-hand corner of this aerial is our Mill Creek treatment plant. So it is a very near field site, and we felt that this would be a valuable sentinel or sentry site for us to evaluate. So we began collecting samples at this sub-sewer shed site. Here's some images of it in the upper left-hand corner. It's a very large combined sewer, and we have a combined sewer overflow. And the structure there is a control structure with flap gates. We hold the combined sewage back into an approximately 19-foot diameter sewer and retain that as long as we can to try to minimize any combined sewage overflow into the Mill Creek. The lower left image is a picture into that sewer, and you can see a grate there. The dry weather flow is diverted through that grate, subsequently through a rock trap, and then we are able to sample that wastewater, that raw sewage, just before it is diverted into our interceptor sewer and brought down to the Mill Creek. We use that remote composite sampler, taking about 10 liters for 3 hours, roughly 500 milliliters every 15 minutes. And then we transport that to the lab for Nicole in her good hands to take. And with that, I'll turn it over to you, Nicole.
Thanks, Bruce. Can you hear me?
I can.
Okay. All right, so hi everyone. In this part of the presentation, I'm going to describe the method we're using to process and analyze wastewater samples, a few of the performance metrics associated with that methodology, and then also provide you some data from our monitoring efforts. And so okay. So this is a flow chart of our sample processing and analysis scheme. We collect for the most part, 24-hour composite samples from each of the utilities, with the exception of the site at Lick Run, which Bruce just described, where we collect about a 3-hour composite sample. And then we bring those samples back to the lab and then split them into subsamples of 225 ml volumes. And we always process each sample collection event in duplicate. So we have 2 duplicate samples for each event. To those samples, we add PBS as a buffering agent, and then spike them with OC43, which is a beta coronavirus, to serve as a matrix process control. So we mix that sample pretty well, and then remove 0.2 mils directly or right off the top for a direct extraction. And then the remaining volume gets centrifuged at 3,000 times G for 15 minutes. And from that product, or from that process, we have 2 different products. One is a pellet, which gets stored for nucleic acid extraction directly from the pellet. And then the supernatant is further processed through filtration through a 0.45 micron membrane filter. We keep that filter and store that for extraction directly off the filter. And the filtrate gets further processed again through an ultrafiltration using a 30 kilodalton molecular weight cutoff centrifugal unit. And then from there, we retain the solution that is in the filter and extract that as well. So from each sample processing event, we have 4 products, and all 4 of those are individually extracted using a commercial kit. And then following that, we perform RT-dPCR analysis to quantify SARS-CoV-2, targeting both the N1 and N2 loci of the genome. We measure the spiked OC43 beta coronavirus matrix process control. We're also measuring pepper mild mottle virus, which is a plant virus that is present in high concentration in human feces, as one of several potential metrics to account for fecal loading and or dilution in each of these samples. We also spike and measure an RNA control molecule that we put into each dPCR reaction to assess potential PCR inhibition. And then we use droplet digital PCR to measure phage, which is a bacteriophage that is also present in high concentration in human feces, again, as another indicator. So one of the performance metrics that we are defining for our method is the limit of detection. And so this is the minimum number of SARS-CoV-2 RNA per liter that we can detect. So this value is dependent on several factors, including the volume of sample processed, the concentration factor, the volume of processed sample that is analyzed, and the analytical sensitivity of the method, which is in this case PCR. So I'm showing here in the graph our detection limit. If we consider our sensitivity to be 1 droplet or molecule, which we can detect, or 3 droplets or molecules, which is the LOD, or the limit of detection determined for PCR. So so considering these analytical sensitivities, our approximate method or limit of detection is 655 molecules per liter. I want to stress, though, that this is under ideal conditions and that the practical limits are probably a little bit higher due to losses during processing and other matrix effects. And we're working on clearly defining our limit of quantification. So if we go to the next slide, I'll show you some results from looking at recovery efficiency of both endogenous viruses that are already present in wastewater and our matrix spike. So again, just to reiterate, the endogenous viruses we're measuring are phage and pepper mild mottle virus. And again, we're also spiking each of our samples with OC43. So we determine recovery efficiency by measuring these viruses in that fraction of the sample that I referred to earlier as the direct extract, and comparing that result to the sum of the concentration of the viruses collected in the pellet, filter, and UF fraction. And so in summary here, I'm showing the mean results of over a number of samples of how much of these viruses we can recover. So crassphage, we recover the highest at about 84%, followed by pepper mild monovirus at about 27%, and we're only on average recovering about 6% of our spiked OC43. So in the next slide, I intend to show you how these viruses are partitioning in each of those fractions that we're producing. So this graph illustrates the results of that data where we have positive samples. So on the y-axis, we have the proportion of the molecules recovered in each of the pellet, filter, and UF fraction. For SARS-CoV-2 as measured by using N1 and N2, crassphage, pepper mild monovirus, and OC43. So the trends here for the endogenous viruses are pretty similar in that the pellet fraction contains the majority of the virus when the sample is positive, followed by the filter fraction, and finally the UF. And of interest, though, the spike virus, the predominant concentration of the spiked OC43 is in the filter fraction. However, if you consider the measurable virus, 90% of the measurable virus in positive samples are contained in both the pellet and the filter fractions. So next, we're going to talk about potential PCR inhibition. And we assess inhibition by spiking each of our PCR reactions with an RNA control molecule. And so we measure, or we compare the concentration of that spike control in sewage sample extracts to a matrix-free, the same concentration in matrix-free controls. And so here I'm showing the proportion of the spiked RNA molecule recovered in each of these different sample fractions. And you can see from the direct extract, the pellet, and the filtered fractions, we're seeing minimal, if any, PCR inhibition. However, with the UF retentate, we're seeing a slightly more inhibition, but still not impactful. We're also interested in understanding a little bit about how storage conditions might affect our ability to quantify SARS-CoV-2 in wastewater. And so since we are collecting composite samples, 24-hour composite samples, and in some cases those samples have to be shipped overnight, we wanted to understand how long samples can be stored before we see a significant decrease in viral RNA. And so this graph here shows some results of that analysis. We collected a sample on Monday morning and then prepared several subsamples so that we could store that sample over the course of 4 days. And so each day, including the Monday on the day of collection, is shown here at day 0, we processed those samples and analyzed them for COVID-2 using N1 and N2. So here you see N1 is shown in the red icons, and then N2 is in black. And these are from the 4 replicate measurements from each of those sample days. You see that as time goes on, we do start to see a little bit more spread in those replicate results. But after an analysis of repeated measures ANOVA, there is not a significant difference in those quantities measured over 4 days. We're also interested in looking at the effect of freeze thaw, because early on in our sample collection, we had to store samples at -880 before we could process them while our lab was still getting set up. So in the next slide, we'll see the results of a freeze thaw event on sample analysis. So here, again, we looked at one sample and processed it immediately, and then another subsample from that same collection event was frozen at -70, and then thawed sometime later at 37 degrees. In the left-hand panel, I'm showing the results for N1, and on this time on the y-axis, the results are in log 10 molecules per sample, per 225 ml sample, because I wanted to illustrate how much was measured in each of the sample fractions. So in this graph, the fresh samples are shown in blue, while the frozen sample results are shown in purple. And there is a little bit, you can see in each fraction, there's a little bit of a decrease overall in detection after a freeze-thaw cycle. And in total, that amounted to a reduction of about 3-fold. However, using a Bayesian t-test, these results are not, there's no credible difference between these results. With N2, however, in the right-hand panel, there are some differences, some credible differences observed for the filter fraction and the UF fraction, which in turn drive the credible difference in the total reduction after freeze-thaw for N2. And that difference is a little bit higher at almost 5-fold reduction. So now I'm going to briefly describe the application of this method for weekly wastewater monitoring. We're collaborating with a number of partners in the Ohio Coronavirus Wastewater Monitoring Network to provide wastewater surveillance data to the state agencies and local communities. So right now there are about 36 sites enrolled, and these sites are sampled either once or twice a week. And in ORD here in Cincinnati, we are processing samples from 10 sites shown here in this red loop. We're also working closely with Bruce and others at MSD to look at the various sewer shed scales that he mentioned earlier. So of interest are the two extremes that Bruce described earlier in the Mill Creek and Taylor Creek. So these represent opposites within the district in terms of flow, dilution, industrial input. And as he mentioned, we're also looking at a sub-sewer shed of Lick Run. So here are the temporal trends of SARS-CoV-2 as measured by N1 in blue and N2 in black for the 12 sites that I just mentioned. So each of these graphs are scaled equally along the x-axis for time and along the y-axis for concentration. And I want to stress that these are the raw unamended concentrations. And in each of these graphs, it might be difficult to see at this level, but there are black dashed lines near 218 molecules per liter that indicate that the limit of detection, if we were to consider one positive droplet, are a detection limit. And then there's also a red dotted line that indicates the limit of detection if we consider 3 to be our threshold for the limit of detection. And then each of the sites each of the graphs, the sites for each graph are listed above the graph. So there's a couple of things I want to highlight from this graph. So at all of these sites, sampling began at different times, which is why you see some of these sites do not have data points early in the time series. And then also a number of these sites have very little concentrations of SARS-CoV-2. But on the other hand, some sites we've observed a little bit higher concentration. So one in particular is the Marion site at the top left-hand panel. So this site is a wastewater treatment plant that serves a correctional facility that experienced an outbreak early in April. And we were only able to start sampling at that location late in April. And you see a peak there, and we were likely just detecting the remnants of that outbreak when we started sampling. Another interesting graph is the one right below it at Dayton. So we were not seeing much signal in the wastewater early on when we started sampling in Dayton. And then the week of September 3rd, we see that peak right there. And then after discussing this data with the local and state officials, we understood that this peak coincided with the return of students to campus at the University of Dayton. And that return included some individuals that had positive tests for COVID-19. And so another couple interesting graphs here are Mill Creek and Taylor Creek and Lick Run, which I'll talk about here in a minute. But one question you might ask is, why do we see differences among those sites? And this gets at the point Jay was mentioned in the beginning, that there are a number of factors that can affect the interpretation of these data, and they include the dilution effect of the various dilution effects among these sites, some decay of the virus through their, during retention time or residence time in the system, the site selection, which Bruce mentioned earlier about finding sentinel sites that might be better predictors of community infection. And so we're doing a number of things to examine these factors. And if you go to the next slide, I'll illustrate one of those points here. So this is again the map of the the Metropolitan Sewer District of Greater Cincinnati. And I'm showing here data from the Mill Creek, which is again the largest sewer shed in the district, and Taylor Creek, which is one of the smaller ones. And these two represent the extremes in terms of dilution in the system. So of interest here, there's a peak in the Mill Creek wastewater system during the week of June 28th. And if you look below that at the Taylor Creek graph, there is another peak or a similar peak of equivalent size that isn't seen until a week after that one that occurred in the Mill Creek. So we are currently exploring a number of parameters to account for dilution, and these two systems are good candidates to explore the impacts of those various parameters. And then if we go to the next slide, we are also looking at a sub-sewer shed within the Mill Creek sewer shed. So this is another illustration of the Metropolitan Sewer District map. The Mill Creek sewer shed is outlined in black. And as Bruce mentioned earlier, the Lick Run sub-sewer shed is outlined here in red. And as Bruce alluded to earlier, Lick Run was identified as having a potentially vulnerable population that may serve as a good sentinel site for community outbreaks. And so in the graphs, we see that the Mill Creek is shown here, where I mentioned earlier the peak happened the week of June 28th. And interestingly, when we look at the Lick Run data, the earliest we could start sampling there was June 11th. And as soon as we started sampling, that's our highest concentration we observed in that system. And then over the course of the next 2 weeks, the signal started declining, which coincided, and the valley of that, that signal coincides with the peak in the Mill Creek. So interestingly, if we had not been sampling the Lick Run site, we would have missed that peak in the Mill Creek. So currently we're working with obtaining the clinical case data for these smaller, more refined scales of the sewer shed and the sub-sewer shed. And we're working on developing models in order to understand how this data relates to the community levels, which Scott is up next to further delve into. And just to summarize, I just wanted to point out a few things that I discussed. Most of the virus that we observed were in the fractions that are more associated with the solids as opposed to the liquid fraction. And we have looked at a few samples to understand better how to handle the samples. We definitely need more data, but from what we have assessed so far, we can hold samples for up to 4 days at 4 degrees. And during a freeze-thaw cycle, we could see up to a 5-fold reduction. And from our monitoring data, we have learned that while we're detecting low levels of SARS-CoV-2 in wastewater, it does coincide with observed increases in new cases. And as I just mentioned, we're developing models to account for a number of those factors that are influencing virus detection and our ability to relate it back to public health information. And Scott's up next to talk more about that.
Okay, can you hear me, Nicole?
I can hear you, Scott.
All right, thank you. Hi, everyone. All right, so the purpose of the next several slides is to investigate the usefulness of Bayesian statistics to determine if virus RNA in wastewater reflects clinical data. And Bayes' theorem describes the probability of an event and incorporates prior knowledge related to that event, so it has priors. The data are fixed and the parameters are considered random variables. And what I like about it, I like everything I just said, but I also like about Bayesian approaches is that you can easily characterize multiple sources of uncertainty as you build a model. Anyway, so to accomplish this task of relating these SARS-CoV-2 RNA in wastewater to clinical data, it's, as Nicole mentioned, it's important to account for factors that influence virus detection in wastewater, such as dilution by rain or industry. As Bruce talked about, some of the wastewater, the sewer sheds have more, they're more combined sewers, they have more industrial influences. These sorts of things can influence detection. And also, we have to admit as scientists, laboratory methods, as soon as we get a sample in the lab and we try to extract the RNA signal from the wastewater sample, that our methods are contributing to some uncertainty. So I'd like to go over sort of a retrospective analysis of the relationship between SARS-CoV-2 RNA and the Mill Creek sewer shed wastewater treatment plant, which is in Cincinnati, and county level COVID-19 case data. In this case, it's the Hamilton County itself. A little bit about the Mill Creek system. It collects up to 118 million gallons daily, and it represents about 80% of the Cincinnati sewer district and serves approximately 488,000 individuals, which is larger than the city itself. And as Bruce said, 40% of the sewage system of Mill Creek is combined sewage. So the next slide, if we can go to the next slide. The first thing to do is to download clinical data from the Ohio COVID-19 dashboard. And this slide shows the dashboard. But when you look at it, what you see cases, hospitalizations, deaths, and individuals that have recovered from their infections. So it's a pretty good dashboard. I like looking at it. And so you can download the data from the entire state, which is what I did. And we go to the next slide. I downloaded the new COVID-19 cases and plotted it just to show visually what it looks like. This is the data from the early parts of the pandemic until, not very recently, but September 14th. I had to prepare a slide, so I had to stop at some point. And so you see, so the larger graph, you see the number of new cases, which is the y-axis. And you see on the x-axis the date of onset of COVID-19. I want to say that not all days were shown here because I couldn't show the plot very well that way. And the upper graph is the new cases by month. So there's a peak, as Nicole alluded to, it's a little bit of a spoiler here, but the RNA is peaking at the end of June and early July. We also see the cases, the clinical data here, peaking, which, as Jay talks about, these two data sets seem to be mirroring each other. So we're going to look at that relationship using Bayesian statistics. So we can go to the next slide. So here's a plot of the cases, which it's a bar graph in blue. So the left axis describes how many new cases. These dates here are not every day, but these are sample dates that we for wastewater from the Mill Creek wastewater treatment plant. So about every week or so, we get a sample. And so those dates, I use those to lock in, looking at the case data to synchronize that with the RNA data. And you see the green and red lines in the plot here are the two genes, N1 and N2. And visually here, the question is, do these two data sets mirror each other? And yeah, there's some degree of mirroring, but there's some differences that we want to understand. This gets back to this question of what's influencing the detection of the RNA, and we need to address that before we can talk about how the two data sets relate to each other. So if we go to the next slide. So we talked about the Mill Creek being 40% combined sewer. So as you would expect, if it rains, then a system like this would be diluted by rain events. Seems reasonable thing to look at. So this plot shows the crash phage, which is in red. Now, as Nicole mentioned, crash phage is, we use this as a fecal indicator. It's a bacteriophage. And we're showing here the levels of crash phage through this period from May 13th through September 9th. And it fluctuates through this time series. It goes down, comes back up, goes down again, comes back up. And this is about over a log change of crash phage. So that left axis is in billions, so it's billions per liter. And the right y-axis is the amount of rain in the last 3 days before the sampling event, just summed up together in inches. And so there, you can see in the bar graph that there's was a rain event on May 20th, about I can't really say too well, about 3 inches of rain over 3 days. And that sampling period, we see crash phage very low, and it comes back up. And then as soon as it starts raining again, we see this association between rain events and the drop in this crash phage signal. And in August, it comes back up again. So this idea of dilution from something like rain, and there's other sources of dilution that could be occurring, is something to account for before you relate clinical data to RNA data in wastewater. And we can go to the next slide, Jay. So here's a linear regression, just showing the results of this regression where the response is crash phage, and you look at the relationship between that and rain. And so it's a simple linear regression. And what we see here is that the rain model has a very high phase factor of over 500,000, which is considered decisive evidence that there's a statistical relationship between rain and the bacteriophage. And importantly, if you look down into this summary of this statistics, the coefficient for rain is has a negative sign. And that means that there's an inverse relationship between rain and the amount of crash phage in the wastewater. Okay, so our thinking here is that we want to use crash phage to normalize for dilution. And so we want to put that in the model. And Nicole mentioned a number of other parameters, including recovery, method recovery in the lab. Also, some of our samples, we had to freeze them because for capacity reasons, we couldn't quite get to all the samples in a timely fashion. So we froze some, not that many, it turns out, but there's some that are frozen. And freezing has some influence on the amount of viruses detected. So you think about all and this is a really very modest diagram here of a phase model where you want to bring in your data, which is ddPCR, this is droplet digital PCR, for the SARS-CoV-2 RNA, and you want to then consider these other factors in your model to estimate as true as possible the concentration of RNA that's in wastewater. It's a really tough challenge because we don't know everything that we need to know in order to do this. But we start to build a model like this. This diagram shows building a model, what can start to go into it, and it gets pretty complicated pretty fast. And this is, of course, it's necessarily incomplete model because, like I said, we don't know a lot of things. But so here now you build this model for the RNA from the virus, and then you want to relate it to the case data from at the Hamilton County level. And so this is really looking at regression between clinical data and RNA and wastewater. And this is just instead of showing math, just show a diagram indicating the connections in the model. So we can go to the next slide. And so one of the things that's nice about phase is that you can monitor in each of those oval spaces in that previous diagram. You can monitor what's happening as you run the model to see how things are going, and you get an uncertainty level around your estimate, indicating the properties of that parameter. And here, just to monitor the RNA per liter in Mill Creek over these from June to late August. This is all the data I had at the time. There's more data, so this is incomplete, but this is what we're showing now. And we see on the left RNA, and this is, I should say, this is RNA without any sort of normalization or accounting for anything, any factors, just the data from the measurement itself. And we can see that it's peaking, as mentioned by Nicole earlier, the late end of June, early July, and it comes down. And there's another increase in August. And if you look at the case data per day, it's also imported into this model. We see it peaks in a similar fashion, and then but it comes down in August and stays down in August. So these two data sets, without any normalization factors accounted for, they seem to be mirroring each other without too much work. So this is promising to go forward. Next slide, please. So this is a bit of a busy slide here, but I'll go over with it. I'll give you to the conclusion first, which is the title of the slide. When you account for recovery using OC43, which is another coronavirus, and freezing, which, like I said, we had to use freezing to store some samples, and you use crash-based to normalize for dilution, then that model is better if you don't do it. Now, what is the model? Just to say it again, we're doing regression analysis between the clinical cases and the RNA and wastewater. So before you normal or you account for all these factors, that's the left diagram here. And on the y-axis is the number of cases. And that's just the clinical truth in that left box. So before we see what the data is from the dashboard, and then we run regression, and we see that the RNA is trying to predict the cases, but it doesn't quite do a good job. It comes up and comes down, but it's not quite there. And then if you run the model check itself, the uncertainty is very high. So then after you introduce these factors, and like I said, the model is necessarily incomplete, but you start to add information to the model. Again, you run it again, another day, you get the case data, and then you look at regression, predicting using RNA to predict the cases, and it's doing better now. At least the levels are coming up as high as they should be. And then the model check has a lot less uncertainty than before. And just to check the, just to make sure this passes the laugh test, if you just add random data to the model, random drop digital PCR data to the model, it doesn't do anything. Just flat. It's a flat line of with no prediction at all. And sometimes when you build bigger models, you want to make sure that you don't have that it's working, right? So that's why I did that. All right. So the next slide is the conclusions. So we see that the COVID-19 cases in Hamilton County peaked in late June, early July, and we also see that mirroring with this SARS-CoV-2 RNA in the Mill Creek wastewater system. We see that environmental features can impact fecal load. In this case, we looked at rain, and we think that dilution is involved, and so we want to normalize to account for dilution in that wastewater system. And we think that the Bayesian framework facilitates a probabilistic approach that's easy to think through as you build a model. So the next steps then are to expand this approach to learn more about other factors, flow rate, wastewater strength, determined in other ways using a plant virus, HF183. And also we want to look at different sewer sheds at different scales to see how scaling affects the mirroring that we're talking about. And it's also important to say, which I haven't worked on yet, is to investigate lag use time series approach to investigate the autocorrelation and cross-correlation between the cases and the SARS-CoV-2 RNA, because the assumption so far has been that you take a sample, you look at cases on that day, they should be correlated, but maybe there's a lag involved with that. And so it's important to pay attention to that. I'll turn it back to you, Jay.
Well, thanks, Scott. And then just a note real quickly, when Scott was mentioning trying to relate the sewer signal to other measures of infection at different scales, the thing I want to point out is we've worked with Hamilton County. Typically, the data is reported at zip code level, as noted here. And what you can see is that the zip codes do not overlap with the sewer sheds. And if you're trying to relate the sewer signal directly to infections of contributing population, you really want to have it listed out the other way. And we're working with them on transferring that data to something like this, which is more the actual case rates by the sewer shed and sub-sewer shed. So that's what's one of the things that Scott's going to work on next, is not just relating back to the overall Hamilton County data, but by sewer shed and sub-sewer shed. And now I'm going to turn it finally to Rebecca to really kind of connect the dots here and translating all this information, given the relative uncertainties, into the public health decision making. Rebecca?
Thank you, Jay. Can you hear me?
I can, thank you.
Okay, next slide, please. So where we've started here in Ohio is there was interest very early on by our governor to develop a state-based wastewater monitoring effort. That started early Memorial Day, and we sought funding and were able to coordinate with the Ohio Water Resources Center at The Ohio State University, with USC EPA, Office of Research and Development in Cincinnati, and the Ohio EPA to start to develop a plan to implement that wastewater network. And we felt like we would start this by focusing on our major metropolitan areas across the state, which also represented our largest population areas. And that was a concern to us because we wanted to make sure we were seeing, possible disease trends or early warning indicators in our most populated areas where we were seeing our hotspots and problems. And so we started out focusing on Cleveland, Columbus, Cincinnati, Dayton, Toledo, Akron, and Youngstown. And as you've seen, some of those facilities have multiple wastewater treatment plants that we were monitoring. And then we've been working to add additional medium and smaller cities across the state. And to try to get good coverage throughout our state, we have a public health alert advisory system that we're using to help select sites. And so we're looking, we're adding sites, we're looking at different selection criteria, including their current status in our advisory network, some vulnerability factors. We've had some vulnerability analysis completed for the state, and we're looking at those factors as well. The infrastructure at the wastewater treatment plant, and then of course the interest in the community and participating in the network. So the next slide, please. So this effort was primarily funded through CARES funding that the state received to develop the statewide wastewater network to monitor for coronavirus gene copies or fragments. And so our entire purpose of the project is really to provide data, to collect this data, to provide as much as possible an early indicator of potential disease trends within communities, to help understand disease trends and the prevalence of disease across our state, and to also use the information to prioritize resources such as testing locations, pop-up testing locations, or maybe focusing where you want to send PPE or other resources across the state. And also, most importantly, to inform community interventions to limit the spread of disease, to help promote public messaging, which we'll talk about in just a few minutes, to really to have the information available to assist communities. So at our full capacity, our network will include about 50 sites across the state, monitored twice weekly. We might get a little bit closer to 55, but based upon recommendations from the CDC, we are increasing our initial sampling frequency of once weekly to twice weekly to get better resolution to provide that leading indicator. Next slide, please. Okay, there we go. So this is just a screenshot of our dashboard. We have a dashboard and a website. It's on the state coronavirus dashboard and website. And what we are displaying here is the link below. So what we are displaying is a state map, which you've seen, I think, a screenshot of a little bit earlier, that shows the different locations where we are monitoring for viral gene fragments. And then you can click on a given location and you'll zoom in to the service area for that particular wastewater treatment plant. So you can see the boundaries of the sewer shed. And this provides context for public health and local community leaders so they can understand what area the data that they're seeing represents and like where they need to target their messaging or other activities. And then below the service area that you see on the map here, you will also see now a graph. We're currently displaying million gene copies per day on the y-axis on a log scale, and then date on the x-axis so that you can see those trends. We're getting ready to add also another graph of average gene copies per liter per date also on our graph or on the spreadsheet. So next slide, please. So this has been an effort of a number of different partners across the state, and we're very appreciative of all of our partners who have participated in this effort. We couldn't have done it all without Dr. Borarova, who's the Associate Director at the Ohio Water Resources Center at The Ohio State University, and her team. Also a couple of the other researchers, Dr. Weir, Dr. Lee, Dr. Lemachau, and other professors that are participating at universities across the state, because we're leveraging our universities to help us with the sampling and the analysis. The utilities are collecting the sample, it's being sent to the various laboratories across the state, and they're performing the analysis and assisting with this entire effort. So we thank the entire team for all of that work. Next slide, please. So most importantly, how are we using this data and what are the public health applications, particularly how are we using it in Ohio and how do we hope to use it? So really our focus with this information is on the trends or significant changes in the number of viral gene copies detected. We've emphasized to our communities that we don't want to react so much on one data point. I think you've seen some of the similar slides. You can see the variability that's present in the data. So we're really focusing on when we see an increase, a sustained increase in data values that's looking at a 10-fold, 100 or 1,000-fold increase in viral gene copies. And at that point, we're alerting our communities of a potential increase in disease. So we're really using this at this point as an early warning of infection in communities, and to possibly look at down the road targeting more specific areas within sewer sheds where there might be a concern of hotspots or other issues. We're using this to message to the public on best practices. Our communications team at ODH has worked on a toolkit that we provide out to the local health districts with social media, press releases, FAQs, so that can be used to message out to the public to be more vigilant in their practices, protective measures. It's also there to for the community or the health district to alert local physicians or clinicians, hospitals about pending possible increases, and then to also really closely monitor that data to assist with contact tracing and directing those types of resources and providing those recommendations to local leaders to take action. So next slide, please. And some of our future public health applications that we're working on, that is working with some of the team of the researchers that I mentioned previously to develop methodologies and predictive models to translate those viral loads detected for comparison to health surveillance data or percentage of infection in communities, and to predict or compare results to prevalence studies for specific communities. Ohio recently completed a prevalence study, and we hope to be able to analyze the data in the context of those results. And then down the road to be able to focus in on some other communities, perhaps disproportionately affected communities where risk of infection is greater, and to look at what those trends are telling us in those locations. And then finally, we're coordinating with the data used in our Ohio Public Health Advisory System. And Jay, if you could advance to the next slide. This is another tool that's available in our dashboard that we're working now to monitor our wastewater data to see how we can integrate that information into the advisory system the state has developed that provides information to the states, or to the counties, I'm sorry, on information that they can use to help make decisions locally, to monitor trends that's occurring within their community. So those are a lot of the things that we hope to do in the future with this information. And Jay, I'll turn it back to you.
Well, thank you, Rebecca, and thanks to all the speakers, and also thanks to the audience for bearing with us through a little technical difficulty there, as well as, we understand that we try to pack a lot of information into a single presentation. Just real quickly as a final summary, and we want to get the Q&As from everyone, which Lonnie Mattis-Curry will kind of lead that, the Q&A. this summarizes kind of, you've got the sub conclusions from some of the other speakers, kind of tying it all together. I think what we don't want to leave you with is that certainly the sewer signal can detect even what I would consider moderate levels of rising infections, right? We didn't have a full-blown epidemic here in Hamilton County or in Dayton, but you can see these things pretty clearly. Even though we're close to the detection limit, we see quantitative increases and decreases. They're not just a binary kind of response. Improving our recovery efficiency is certainly a priority, as Nicole mentioned, went through that data for the OC43, even though it's one estimate of recovery of SARS-CoV-2. It is relatively low. Trying to improve methods to get better recovery would maybe increase the sensitivity. And then we really are focused on further analysis to refine those normalization approaches, like Scott mentioned, in addition to the crass phase, some of these things that, as Rebecca mentioned, we already are using on the website, the flow measurements, understanding the relative performance of different normalization approaches, and directly relating the wastewater to infection rates in sewer shed populations, as we showed too. And then I think it's important also to look at this degree of potential early warning, right? The data we showed seem like there's a good mirroring, but not necessarily early prediction. Now that is somewhat a complicated response because with the work that Scott was doing relating back to the kind of curated data from Hamilton County, from the state, we really are looking in real time, and that data is refined over time and improved. So when we say early warning, sometimes it's how quickly you get the wastewater data versus how quickly the infection rate data is being updated and modified. But certainly it seems like it can detect responses, and whether it's how early a warning system or not, it certainly seems to be another clear indicator for folks like Rebecca to use in the public health decisions. And I just would say, given that this is an ongoing collaborative evaluation, the experiment still goes on. I think all of us who are participating in this would agree that we're still looking at this, understanding. Rebecca and I and others were on a call earlier today trying to really talk about what are the specific thresholds or trigger points for decision making. When do we go out to the community and warn them and inform them? And not do it in a way that's kind of crying wolf, but do it in a confident way. So, and there's still work to be done on what the specific algorithms we would use for that. And then finally, this question of defining optimal sentinel sites appears complex. The data that we showed from Lick Run, for example, certainly there was an early signal there 2 weeks preceding the general response in Hamilton County. So maybe that is the right site. It was picked because of the reasons that Bruce mentioned, that it was a community that had to go out to work that was probably more likely exposed to the virus. Now, is that kind of driver going to be consistent through the pandemic? As we see now, like with the Dayton study, it seems to be rises are related to activities associated with the younger adults and maybe college openings. So, trying to get the right site at the right time, and kind of closing this out, getting back to the original slide, adjusting the right knobs, like Scott mentioned. If you're going to look at larger sewer sheds that may be more complicated, understanding the factors that might be affecting that signal, including dilution or even industrial discharge, which we really have not clearly evaluated yet.